From my vantage point, one of the biggest issues with healthcare going on in Alaska right now is healthcare workforce. Some of our programs within my unit are the SHARP program, so that is providing state loan repayment programs, or our newer initiative is employer-based payments to be able to help healthcare providers pay off loans. So they're usually targeted to some of our higher level healthcare providers, but I think what we want to see is incentivizing those lower level providers too, and making sure that we're hitting all areas of access. Something that I'm starting to cue in on as we start thinking about grow our own and kind of think about how we can import less people to fill these roles. There's a lot of focus on youth and education, and that's a really important role. But what I've seen in my career is that healthcare, you kind of change over time. And so maybe it's not the high school student that you want to target, maybe it's your EMS provider or a paramedic that is already interested in healthcare, but maybe needs a scholarship or some way to start thinking about taking that next step into a different level of care. Maybe they're interested in nursing school. Maybe they're CNA and then they step up to being an LPN or do other education opportunities to keep moving up in that chain. They're already in the communities, they're already in Alaska, they already like Alaska, they want to serve in those roles, and so that's what I'm trying to work through is how do I start targeting those healthcare professionals? We're just there to support, and so we're supporting our partners. Our partners at the Primary Care Association, at the Hospital Association, at the university. There's all different levels, and so sometimes it's as easy as just connecting them. Or you hear one idea that the other is working on and say, hey, you guys should get together on this because you have funding for this and you have funding for that. How can you pull it together and really take it to that next step?